So before I begin with the topic of the today, which is my topic, that is doctor-patient relationship, and this is majorly a topic from your MBBS course structure also, where the focus is on medicine and social sciences and how they interact and how the evolving social sciences with the coming human rights and more focus to mental health is affecting and molding the future code of conduct of medical sciences. So most of you, I think, who are studying in India, you have a entire course structure about medicine and social science where you have a written exam and a viva also. I'm not sure about the students who are from different countries like Africa and all, even Russia for that matter. I'm not sure if you people are studying that, but it is not merely a passing exam. Obviously, there is a lot more to pick than just passing it. Right. So before focusing on the real content of this session, I would like to ask you about the session on CPR that you attended a few days ago with the Red Cross. Can anybody of you just reframe or revise what you really learned in CPR? Can anybody revise that?
Yes, hello.
Yeah, yeah, yeah.
I want to introduce myself. I'm Rama Al Tawil. I am a member in the PRASHA and Red Cross. I was one of the instructors there.
All right.
Thankfully, for the help of our teacher, we had a great opportunity to experience teaching others about CPR, and it was so much like fun and entertainment for everyone. I didn't understand well your question. Do you want to say
Yeah.
what?
No, I just want you to tell me, when do you do
Mhm,
CPR and why do you CPR?
mhm.
In like a small
Yeah, of
reframed
course.
sentence, yeah.
Of course. So CPR, as we know, it stands for cardiopulmonary resuscitation, in which we use it whenever the heart stops. And we don't do CPR for all patients or victims who just collapse. We need to check whether they are conscious and not breathing as well. If those two criteria are present at that time, of course, we need to call the ambulance and then start the CPR steps.
Right. So can I paraphrase this as you do CPR when you need to revive somebody? Can I say that?
Of course. In order to increase the time of clinical death, as we know, there's clinical and biological death. So the clinical death of the brain is about 3 to 5 minutes if the blood doesn't reach the brain. So doing CPR, we are acting instead of the heart in order to pump the blood to the brain and extend the time of clinical death.
Right. Rama explained this beautifully, and this, like, it was technical from the view of a psychologist, though. But yeah, it was beautifully explained. And since you all agree that it is to revive a person, revive a dying person, or maybe a dead person, similarly, the point I'm trying to make now is that in the today's scenario, today's modern medicine, according to the studies and according to the doctor patient scenarios in different countries, it has been concluded that the doctor patient relationship is dying or dead. In most of the instances, the things that I read in the newspaper and the articles is mostly about how some doctor was beaten up after a patient died, or how a group of people, a group of indigenous people lynched a doctor because there was some negligence. I even come across this same news from the developed countries where it is not lynching or beating, but it is more like somebody have filed a lawsuit against the doctor, and the number of these lawsuits, the number of these incidents, and the number of news related to the similar scenarios is increasing, and it's rising rapidly. The point being that why this news articles and the incidents are rising from the last decade itself, and why these were not there before that. So after a long study and reading a lot of articles from the reputed journals of psychiatry and psychology, there are a lot of social scientists, social psychologists who have clubbed with the doctors and the clinical psychologists, and they have come to a conclusion that because earlier they used to consider doctors as God, they had a entire trust in the God, as Ranjana ma'am also mentioned, that the trust is something that plays a crucial role in medicine, in healthcare. Current scenario is something where this trust is broken, this relationship is not taken seriously. Give me a minute. I want to know, is the PPT visible?
Yes.
Yes, yes.
Yeah, right. You all can see it, right? Yeah, so coming to today's agenda, it is effective communication and empathy in medical practice, strategies for building this trust and rapport with the patients, and what are the psychological aspects that take place from diagnosis to treatment. Most of you are doing MBBS, most of you are in the last year of it, and you'll be soon getting a license or a degree, which will make you accountable to a lot of people, to the people who come to you and the people who allow you to be a doctor. With that, I mean that your country's constitution is not giving you the right to be a doctor. It's the people who are placing their trust in you, who are placing their trust in your degrees, who are placing their trust in you when you're roaming around with a stethoscope, and they know that if they have a problem, they can approach you. Or if you're traveling in the flight, they can approach a doctor on the plane. Now, this increase the accountability you have towards people also. So the goal, your primary goal is to prevent or restore the health. And then your another goal is to do the diagnosis and treatment, which is cure process. There are nurses in your profession also whose role is to do the care process. So it's cure and care that goes hand in hand. With rising advocacy on mental health, we can see a lot of clinical psychologists and counselors and palliative care counselors who are on board to give the care process also. Now, these two things has to be paired with your intention to do absolute benefit to the patient and without any intention to harm. The worst part about this is that in the current scenario, as you can see on the screen, the patients are mostly in the line of enlightened patients, which is on the fourth category. So I went across a lot of ancient Indian texts, and because I wanted to find out how they are describing patients and doctor, and not really, the behavioral sciences are not there yet to describe in them in proper category. So I had to refer to some of the text, and I also found this very precise, that the patients are divided into four sort of categories. There are the one who are ignorant, like the one who place their entire trust in the doctor. They are not bothered about anything else. They're not aware about the diseases. They go to the doctor, whatever doctor says, they agree, they listen to it. The second one are the informed one. They are aware about the diseases. They are aware about their rights. They go to the doctor. doctor give them medicine, they discuss it, they agree to it, they buy the medicine and start with the process. Then there are empowered one who are slightly more than the informed one, and they have more info. They are the literate one too, though they might not be the doctors, but they are aware of it, most of the things. And then the fourth and the worst category, which I would like to frame it that way, because these are the enlightened ones. They refer to Google, they refer to all the articles in a way that they have lost their trust in the doctors. Now, the second thing about the type of doctors, is somebody saying something? Yeah, yeah.
Yes. Are you changing your slide on the PPT because we cannot see the change in slide?
No, I'm not changing. I'm talking about the type of doctors.
Sure. Thanks so much.
Which slide can you see?
The first one, the
Yeah, I
doctor
am.
PPT.
Oh, you can't see my slides changing.
Yes.
Ouch. Let me present to you again. Uh, did you see this slide? The goal of a doctor?
No, we were like stuck on the first slide, so we didn't see anything.
Thank you for interrupting. Yeah, these are the kind of interruptions that I'm thankful for. Right, so I was on this slide basically, where I was talking about the type of doctors and the type of patients. And I've mentioned four type of patients according to ancient Indian texts. And they're talking about how people existed as patients before. They were the one who were mostly on the ignorant side, so they placed their entire trust in the doctors. But with the changing scenario, since there is a big paradigm shift and the patients are more on the enlightened side nowadays. About the type of doctors, there are doctors which consider themselves as supreme. They consider themselves as God. Whatever they are saying, that is right. Do not ask questions and just take the medication which they are prescribing. Then there are again doctors who give you a choice, like if you want to go for a surgery or a long-term medication or something. Then there are third and the best kind of doctors which take time, they sit with you, they listen to what the patient has to say, and they discuss with the patient about the entire course plan and entire treatment. The the miscommunication over here is the cause of fight between doctors and patients over here is that the patient has a paradigm shift. They have shifted to the enlightened patients, but the doctors are still on I am God category. They do not entertain patients interrupting. They do not want to give patients too much time. And this is not something that I'm saying from my reference, but this is something that I have studied from hundred of research papers. And most importantly, there is a study that is done by Indian Medical Association, and they have interviewed 1,000 plus doctors, and they asked doctors that why are you not, what do you feel about patients? And they said that we are not happy with the patients because patients are the one who are, we do not feel secure, we do not feel safe around patients, because if we do something wrong or if something goes wrong, we are threatened for our life. And similarly, they also interviewed somewhat 3,000 patients, and then they asked that why are you not, what do you feel about doctors? And the patients said that we are not happy with the doctors because doctors are not communicating. And this is a certified published survey, majorly on the Indian subcontinent, but the number of research participants is such wide that it is relevant. Right. So I think that this gave you a little answer about why there are rising cases of lawsuits or patients threatening doctors. And this might be a concern even that if you will get into practice, how will you sort this out? There's a very simple answer to this. Since that times have changed, you need to be the doctor who takes time, listen and discuss the entire thing with the patient. Now, before I go to the next slide, I would like to here give a reference of a textbook, Hindu textbook, which is Bhagavad Gita. Most of you may be aware of it. Most of you may not be, but just listen to this. So this textbook is a religious textbook of Hinduism, and it talks about Krishna, who is the god, and Arjuna, who is basically fighting in the same war of Mahabharata. Now, let's not see this as an ancient Hindu textbook trying to teach us some Hindu mythology, but let's take this as a counseling session where Krishna is trying to convince, where Krishna is trying to counsel Arjuna about the anxiety that he's having about the war. So this book is divided into 18 chapters, and the lovely part about this is that the entire first chapter is about Arjun explaining the things to Krishna, how he's feeling, how he is, his hands are trembling, his thighs are shaking, and his heartbeat is so high. He's not sure about this war. So, what should he do? So, this entire chapter is about Arjun, and Krishna does not utter a word. Now, this suggests that how important listening is. The next chapter, which is chapter 2, is where Krishna starts explaining, but Arjun is confused. Now, this is something that is applicable to the situation where there is a doctor and a patient. There may be times where a patient do not understand what you are talking about. What disease are you talking about? There may be also a time where a language, your English reference is very different from their understanding. So you do not have an idea and the patient is confused. So similarly, so here in the second chapter, where Krishna starts explaining and Arjun is listening, he is confused. He is asking again that, do you mean this? What are you saying? And from chapter 3 to 17 of the same book is where Krishna is explaining, giving reasoning, and then also ensuring that if something goes wrong, I am there to help you out. Something that doctors also are supposed to do: explain, give reasoning for everything, and give us and give patient this assurity that assume me there. I am there to take care of you, and I will sort things out for you. And then the last chapter, which is the chapter 18, is something where Krishna is revising the entire thing in front of Arjun. Something that you are also supposed to do. Highlight the entire process, entire things that you talked about, and if the patient has understood it or not. I read this similar process given by Indian Medical Association, and they're talking about a process in which there are 5 steps. They named it as alert, ALERT. A stands for acknowledgement, L stands for listening, E stands for explanation, R stands for review. These are all the processes that I've already explained. But there is an additional last one, which is T, which is thank you. And here we are not talking about patient thanking you for your service. Here we are talking about you thanking the patient for giving you an experience, for giving you an opportunity to tackle with certain disease, and that you are thankful to the patient for being a part of their recovery process. Now, this all is very important for rapport building. There is another very important thing that is added over here, which is health prevention. How do you prevent things from happening, the disease to relapse? And here you are the one who are supposed to suggest things like healthy living, healthy lifestyle, what to eat, what not to eat, what to listen, what psychologists to refer in the caretaking process. The most important of which is how to communicate things. Now, these are the three important factors that you need to consider when you're talking about how do you communicate with a patient. The first one is intellectual plane. Now, the MBBS textbooks of India, if I go through them, there is a very important word given over there, and it is about social distance. Now, this is not the social distance from your COVID time, but this is the social distance which is pointing out at a gap. And this gap is between the practitioners and the illiterate patients. Now, many a times, you people are like, I'm not blaming you or something, but I'm pointing to a major fact here that many a times there is a practitioner who had studied in an English medium college, learned their entire medical studies in English, or from the countries which are not indigenous at all. And when you're not able to focus on your patients, give them proper care in their indigenous manner, and if you're not able to explain them in a simple terms, this is the time where a patient makes distance from you. Distance on all the levels, on the emotional level, on in form of treatment, they might not stick to the treatment, or they even shift the doctor. This is also the time where the patient shift from allopathy, which is the English medicine, modern day medicine, to the different form of medicines like Ayurveda or homeopathy, because these are the people who are indigenous and who are able to communicate on an intellectual level of the patient. So this is something that you need to inculcate in a way that no matter what you have studied, how you have studied, if you're coming to a if a patient is coming to you and if you're interacting, you need to be on the same intellectual plane as that of a patient. Similarly, there is an emotional plane where you need to have a sympathetic ear and empathetic response to whatever the patient is saying. Now, this is very important since the patient comes with a lot of symptoms. They are all the problems they're experiencing and have an emotional response to all those symptoms. You as a doctor already know the symptoms. You might have even diagnosed in your mind that what this person is going through, and you may not be sometimes may not be interested in listening to the emotional baggage they are carrying with the physical symptoms. This is another point where if you lose a sympathetic ear and an emotion and an empathetic response, you may have a social distance with the patient. The third and another crucial point is cultural plane, where you need to be aware of all the customs and culture of a community. To consider this as an example, where you are working as a doctor in a vegetarian community, and if a malnourished child come to you with the mother, and you start suggesting that okay, start eating eggs, start eating meat, start take liver cord oil twice a day, that is something that would make a major disconnect and might even ended up you being thrashed. And I'm it's not a joke, it's something that has happened. This is another example from a news article that certain doctor recommended non-vegetarian food to a vegetarian child, and that is how the community reacted. So before taking your actions, you need to have a cultural awareness and the knowledge about where you are actually working. There are times when you also face competition with a lot of cultural formats like Ayurveda, neuropathy, homeopathy, and things like that from your different countries, whatever the indigenous systems are. Now, there are two ways to go about it. Either you make your medical practice as good, where the patient is feeling a connect with you, a patient is able to make a trust with you, or you coexist with these systems. There are times when there are a lot of things about lifestyle, about habits, which is right in the indigenous medicine, but is not addressed by the modern medicine. So there's nothing wrong if the patient is coming to you with an insight from the indigenous medicine, and if you agree with it, if you have a knowledge of it, so there's nothing wrong in coexisting with that system of knowledge. Okay, the another Okay, before I go to this topic about the psychological aspect from diagnosis to treatment, is there anybody who has any question from this portion? Can I move forward?
Yes, I think.
Okay. Right, the PPT is visible to you. Okay, so the
Yes,
another agent, it is right.
yes.
Okay. So the another agendas of today's session is the psychological aspect from diagnosis to treatment that a patient goes through and that you as a doctor need to tackle with to revive or regenerate the doctor patient relationship. The first one is when you receive a diagnosis, there is an emotional impact on the patient. A patient is there with you, there in front of you with all the shock, fear, anxiety, and sadness. And then you have to emotional, address this emotional response of anxiety, fear, sadness in order to facilitate coping. Now, coping, everybody have a different coping mechanisms. So you need to identify the coping mechanisms and supporting healthy coping mechanism for stress and anxiety. You also need to encourage the open communications with the family, within the family, and with the doctor, the nurses, and anybody who is a caregiver. Now, there is a portion where I explained you in alert, where you need to explain everything to the patient. Explain in a way that is understandable to the patient, which is on the same intellectual plane, which is on the same emotional plane also, and on the cultural plane also. Patient may struggle to understand complex medical information. Effective communication and providing information in digestible segments are crucial. Now, there may be the situation that maybe there are diseases which are not digestible to the patient. You need to go differently about it. But if there is a disease, if there is a health issue that can be addressed properly, you need to address that information with the patient very precisely. The second step is understanding treatment options and informed decision making. It comes with facilitating shared decision making with the healthcare professionals and the patients, ensuring patients understands the benefits, risk, alternatives of treatment options. You need to manage uncertainties also. So at the same time, acknowledge what this treatment can lead to uncertainties and what are the uncertainties surrounding this entire process. And you provide the ongoing support for any decision related issues regarding that treatment. You yourself can provide the psychological support, but it's better to always have a counselor, a clinical psychologist, a palliative care counselor on you, with you on board in the hospital. There are almost all the hospitals who hire a clinical psychologist and a counselor who take care of all the psychological support that you need to provide. Now, this person, the psychologist, is also the one who would make support groups regarding a chronic disease or something that a patient is struggling with. This support group in itself provides a lot of social support to the recovering patient. Now, identifying and addressing any mental health concerns that may impact treatment adherence, like how much a person sticks to a treatment, would be identified by a psychologist itself. So it's the role of you and you working with a psychologist on a patient to identify what can make the patient stick to a certain mental health plan or certain treatment. All right. What you will do during the treatment when the person has made the decision, it is in the treatment process. You are there as a doctor, you are the facilitator. It is your duty to motivate the patient to stick to the treatment and understand the factors that are influencing the treatment adherence. It is your duty to again motivate patients through positive reinforcement, appreciating when somebody have taken medicines on time, appreciating if somebody have faced a new symptom and approach to you instead of googling uh, or just giving no heed to it or just delaying the consultancy. So you need to positively reinforce if a patient is trying to stick to a treatment plan or do something better to the life. The next part of this is quality of life. How would you promote health and maintain the quality of life? You can do this by monitoring and addressing the impact of treatment on the patient's quality of life. And you can also address concerns related to the side effect, pains, and the discomfort that a person might be feeling related to the treatment. There is always a social support system which you can always ask the counselor to make the person to make it for the person, or you can encourage the family and friends to stick to the patient and be a part of their support system. You recognize the role of social support in mental health, and you and the counselor that you're working with on one patient recognize the crucial role of it in the healthcare process. Now, there is always a post recovery time where there is when the person has healed or the person is on the verge to be disease free or healthy, then the person is always have a transition to normalcy. That is the time where you need to assist patients with this transition. It may be difficult for a lot of the patients to get back to the normal life after a chronic illness or after something that has had an impact as a traumatic impact on their existence. So you will be the one who will be assisting patients in transitioning back. You need to also address the fears and anxieties related to the potential relapse. So you will be the one who will be explaining it to the patient that yes, there is a potential for relapse and these are the preventions that you need to consider, you need to adhere to not allow the relapse to happen. There is also a lot of psychological resilience. So, fostering psychological resilience in a long term well being and providing resources for managing potential post treatment psychological challenges. So, you can always, you and the psychologist that you're working with can address the post treatment psychological changes a person might feel or go through after certain treatment. This is also known as follow up care, which where you are ensuring the ongoing psychological support, that is you are having a follow up with the patient, and then you are monitoring and addressing any sign of mental health concerns post treatment. Yeah, so to conclude this knowledge of how the practitioners of social science, majorly psychology, and the domain of having a human side of medical practice. As a doctor, if you use this, if you adhere to all the steps, if you be a good doctor and take care of your patient for the entire time, this is a trust building exercise, and this is something that will help you to bounce back from the general notions that we don't trust doctors anymore, and from the general notions that the patients, we are not happy with the patients because patient can cause harm to our lives. That's all. And yeah, to conclude this, please let's stop considering the patients as consumers. Okay, let's get back to the era where you are a healer and then your job is to heal a sick person without doing any harm, instead of keeping your practice in a way where you're considering your patient as a consumer. So that is how we can revive our dying relationship with the patients. This is all for today.
Thank you so much, Aditi. Do you guys have any question? You can ask us. Okay, so if nobody has any question, I would like to thank all of you for joining the webinar today. We'll continue the next session tomorrow. We have two other sessions, and I would like to ask you guys. Uh, I would like to ask you guys to please fill the form, the feedback form, which I'm right now sending in the chat box, so that we can get your reviews and your suggestions. Okay, those who have raised their hands, do you guys have any question? Do you want to ask something to the speakers?
You can just switch on your mic and ask the question, it's fine.
And please don't forget to fill the form before leaving the room. Your feedback is important for us.
Yeah, I don't know if I can go ahead with my question.
Yes, you can, and you are audible. Go ahead.
All right, thank you very much. So this is a Benisha, ambassador to Zambia at PRASHA. And my question is, most of the times that we also get to have, I would say, stubborn or very respective patients, so to say. You find that maybe you're approaching the patient in a calm manner, but they tend to be rude. How can you balance, or how can you strike the balance between you in trying to be professional and also receiving such attitude from such patients? How do you balance in such cases?
Right. So from what I can get from your question, I think you were asking that sometimes the patients are very rude and they kind of give you attitude while they're approaching to you. And from what I can identify, the cause of this is that they have already been attended by doctors who may not be giving them pure attention or understanding their problems. So maybe that experience while coming to you is coming along with them, and that's why they're rude and having an attitude towards you. Your role here is something from the word alert that I have mentioned, is to acknowledge that you as a doctor have information about this thing. You are an expert in this domain, and you are here to listen to the person. And then, since even with even when the patient is listening to you and still being rude, there is a time when you need to listen to their symptoms, the things that are coming with. You need to give them proper time. You need to explain them what do you feel about it and what is your diagnosis, and then they can always decide if you want to carry on with the treatment or not. But it is your duty to establish that rapport with the patients. They may not have entire trust in you because of the prior experience, or they are the enlightened patients maybe. But to form a rapport, to be humble, to address their issues, to listen to them properly, I think that is the first step in you and the patient building a relationship. I think that answered what you meant to ask.
Thank you very much. My question has been answered.
I have a question. I don't know if you can go ahead.
I think I don't know who is asking. Yeah, you can go
Oh,
ahead though.
okay. Yeah,
Yeah.
it's Isa or
Is it
Akim
from
from
me or is it from Dr. Ranjana?
uh but I'm able to get you. I don't know if I can go ahead with my question.
Yeah, go ahead, ask.
Oh, okay. So my question or concern, like I'll get I'm based in Zambia, Africa. So like what we tend to see here is that here comes a patient, maybe they come for a consult, but it's like they are preoccupied with their own diagnosis. Then when you try to take a history and do your examination, find that what the patient are complaining and all that, it's not matching. So you try to give them the new diagnosis, but you tend like you go separate ways. They cannot able to go. You as a doctor and the patient, you are not agreeing. So I don't know how you can like some of the strategies you can use to make sure that maybe get along and make sure that maybe they understand that the problem they have.
Right. So before I answer this, I hope you all understood the question. It is about when there is a doctor who you as a doctor, when a patient comes to you and there's a diagnosis that you gave after taking after doing all the history taking and examination and all, and then you are made with your diagnosis. The patient is not agreeing with your diagnosis, and then there is a dispute in between. So how do you make a patient uh, agree to your diagnosis or be on the same platform? Is this what you asked?
Yes, yes, that way. Yes, yes, yes.
Right. So the doctors over here, 92 doctors, would any one of you would like to address this? Can I randomly pick a person? Would anybody would like, how would you tackle with the situation? If I come to you as a patient and you make a diagnosis and I am that enlightened patient, which is saying that no, you're doing the wrong diagnosis and I don't agree with it, what would you do? Yeah, I think, yeah, yeah.
I'll ask the patient that what is the reason why he or she is disagreeing. Like maybe there's something, a trauma associated with it. Mostly people have this family history with that same disease and they're in denial. They're like, no, it can't be me. So I counsel it, I refer them to a psychologist. I try my best to stay as calm as possible and not to trigger the patient, because that's not what I am there for. I'm there to like counsel them and like give them a comfortable and a safe place. That's I think I would do as a doctor.
Right. So this is something that I think Fatima, she pointed it out really well, that in such a situation, there may be a times when a person is also going through certain psychological issue. Okay, and it is not just physical. So if you're giving a diagnosis and the person is not
It's Adan. Sorry to interrupt. It's Adan Fatima. The name is Adan
okay,
Fatima.
all right, all right, all right. Uh, right. So yeah, so when you are there may be a psychological backstory for a person to not agree with your diagnosis. This is the time where you can and you should consult your fellow clinical psychologist or anybody psychiatrist to dig deeper into any psychological turmoil that is preventing the patient to stick to what your diagnosis is, or is there something because of which the patient is approaching the doctor again and again and is not ready with the treatment? So I would like to give you an example. It just recalled me of a story that this is the incident of AIMS New Delhi here in India, All India Institute of Medical Sciences. I was doing a internship there, and then there was this girl who came to AIMS, and her mother said to the doctor that this girl was not born blind, but she's not able to see since last many months. And we have approached a lot of doctors, and now we have approached AIMS Delhi. So they went through all the tests, okay, for blindness, for everything, and they found out that this girl is not biological blind. Again and again she was switching doctors within AIMS itself. She was approaching other hospitals too. Now they were giving her a diagnosis, she was not taking the treatment. Again a diagnosis, again a treatment, not sticking to it. Approach, changing the doctor, changing a lot of doctor, okay. Now, what this one doctor at AIMS did, he referred her to the psychiatry department, and then she was there with her mom. And me and the psychiatrist over there, we were taking her mental status examination. And then we figured out that she might have a traumatic experience or something going on in her house that is compelling her to stay out of the house and seek medical help. So what we asked the mother was, what is going on who is troubling her and what are the situation that she's actually going through. Now, this girl, we asked her to cross the road without any support, and she actually did it. She was a blind girl technically. So that is when it was confirmed that this girl is not actually blind. She can see, but her body is making her blind. Her mind is going through something which is making her switching doctors and switching treatments and all. So that is when we found out after a lot of interrogation with her mother that she was abused by her father at home, physically and sexually, and that is why she don't feel like staying at home. So during evening when a father returns back from work, she urged the mother to take her to the doctor as she's having pains and she's having different issues and all. Now, this may not be the direct example relating to what you asked, but I'm trying to highlight a situation here where there is something larger to the physical symptoms, and that can be identified either by somebody saying in the chat box, either by doctors, another doctor's opinions, or by you digging deeper into the entire situation. So that can only be done when you interact with the patient, you listen to the patient, you make sure that you pay attention to all the verbal and non-verbal cues, the body actions, the situation where a person is talking and stumbling upon certain words. And that may be a cue where the actual problem is lying and why a person is not sticking to the treatment or agreeing to the diagnosis. Now, there is another thing that I would like to say to this is it's not necessary that you force a person to agree to your diagnosis. You do not push the trust. You can always ask the person to talk to another doctor. You can recommend, you can suggest, and you can refer to a bigger, better doctor or somebody which has a huge reputation to even uh, to even bigger better doctor to make the person satisfied by the doctor's name and reputation. So that can also be done. Is is like that answered what your question was? Right. Is there anything we want to ask further, or can we just conclude?
I have a question.
Right. Go ahead.
Okay. This is Camila from Zambia. My question is, you mentioned earlier to say you need to explain to the patient when you're looking at psychological aspects from diagnosis to treatment, and on receiving diagnosis, you mentioned to say you need to explain to the patient on some or on intellectual, emotional, and cultural plane, right? Say a patient comes to you and they don't really want to take, say, modern medicine. They're just sticking to their cultural practices or drugs that they believe in. How do you speak to them and say, convince them that, say, this medicine is better? Say, when you don't really have knowledge on cultural practices or medicines.
Right. So what Camila is asking about that if a person is not trusting modern medicine, which is your allopathy, and if the person is approaching you, how would you make a person understand that your medical practice is right and their indigenous practice might not be impacting or improving their health as much? So would anybody like to answer, or I am sure there are a lot of students who are from the countries which are following a lot of indigenous medicines already. So how would you address this situation? Anybody would like to address this? You as a doctor, if you're going through a situation where somebody is coming to you and do not trust your modern medicine, is more comfortable with the indigenous ancient medicine, how would you address it?
Hello? Are you able to hear me?
Yes. Yeah. Go ahead.
So this is Derek Zuru. For me, what I would do, I think, first of all, is to find out why they've come to the hospital, because this is a person, she said, who has believed in indigenous medicine. She thinks the modern medicine can't help. So this person could be somebody who's had a chronic disease for a long period of time. And it could be that they are frustrated, they think they can't be helped, but they still come to the hospital. But they have in mind that the medicine you give them can't help them. So you need to understand, you need to ask them more questions to find out the reasons why they're saying the medicine can't work. And need to also to find out why they have come to the hospital. What is it that they want from you as they have come to see you? I think when you ask those questions, you can reach an understanding as to why maybe they have got those reasons and see a way in which you can help this person.
Right. Derek said something which highlight the importance of why has a person switched certain form of treatment. With that, I mean, if a person is approaching you, he is already on the verge where the person has tried different things and is over with it. Those things are not working on him and has tried and decided to approach you. So at that point itself, a person is coming with some spoon of trust on their plate already, that they trust you over somebody which was not effective in their treatment. So figure out what has triggered them or made them leave Ayurveda, oh sorry, any indigenous medicine and has approached you. This is also the time where you explain them in a proper manner that what treatment you are deciding to give it to them and the medicines that you are writing would help them in a way. And I think since they're already coming with certain trust, they would be interested in listening to your side. Also, I would like to add another thing here, that I'm not a doctor, okay? I worked with hospitals as a psychologist, not as a doctor. So I think your professors at the university who are teaching you medicine would be the proper one to address this question. But my opinion here is that if somebody is coming to you over anything else, is already coming with certain form of trust. So you need to build up upon that.
Thank you very much. I do have one more question.
I think, do we have time, Paridhi? Yeah, we'll listen to you just a minute.
Okay.
I think the people who want to stay here and interact can stay. Rest of you can just fill the form and leave. Who are not interested. There's no compulsion to be here till the end of the session, and you can all discuss if you feel like. I think Ranjana ma'am can also be a part of it. Ma'am, you're still there, and
Also, I would like to mention that tomorrow we have a specific session for question and answers. So you guys can discuss your question there. So
yeah, the psychology related questions can be taken up tomorrow entirely. Since I read the questionnaires, like the form that you filled, there are a lot of questions about stress, anxiety, depression, and getting over people, getting over negative situations, and all. So that all can be addressed tomorrow. Specific to this session, if there's something, Camilla, is your next question related to this? You can go ahead and ask.
Yes, my question is related to this.
Yeah, go ahead.
Earlier, when we were talking about mind-body connection, there was mentioned to say sometimes patients respond according to what they hear. Say you're giving them medication, right? Then you give them side effects. You find the person actually throws up even when you just give them water. But then when we came to your session, you mentioned to say when you're giving them drugs, you mention, okay, these could be possible side effects and the like. So that was a little controversial. So I wanted to find out, is it advised to not mention side effects to drugs you just give patients, or you tell them to avoid their minds causing them to get sick or worse? Yeah.
Okay, all right. I want to rephrase the question that she's asking. That what in medicine they are suggesting is to inform the patients, that is informed consent and informed decision making, where you are informing about all the side effects of certain medication or certain procedure, but at the same time you are we were talking about the impact of placebo in the modern medicine. Ranjana ma'am, would you like to answer this?
Yes, we need to inform them the side effects, but at the same time, we need to tell them that these side effects do not occur in everyone. Now, 1 in 100 or 1 in 500 people get those side effects. So those warning also we need to give, because if we tell them these are the side effects which everyone is facing, then definitely that impression they will have that we are also going to have those side effects. So we need to educate them about this also. Not everyone faces these side effects, and at the same time, we also need to educate them as a doctor, as a counselor. Also, we educate them, but as a doctor, you need to tell them that how your thoughts will also affect your body. So, little bit education about that also need to be given.
I would like to add on. There are many a times where the modern medicine practitioners do not really practice placebo. Most of the studies that we quote are from the research that they have done, the experiments they have done, and these research and experiments were done with the approval of the ethic committee, which is different for all the countries, and they comes under ethical code of conduct. Though there is nothing wrong against placebo, but I'm sure your a particular country might have certain ethical guidelines related to this, that how much placebo you can use in your practice or something like that. I'm sure there may be also guidelines about about the severity or of a disease. Like you cannot put placebo on certain diseases, on certain situations, or there may be times there where it is clearly mentioned about uh, the side effects of all the things. I'm sure there are side effects of most of the medicines, and it is also mentioned. It may be mentioned in your ethical practice, like the ethical code of conduct, that how appropriate and what are the situations where it is appropriate to tell the entire thing. There are certain undigestible situations where you inform the family instead of the patient itself. So that need to be coordinated with your code of ethical conduct.
Aditi, you are muted.
Anything else coming up, or we are done?
I'm done. Thank you very much.
I
All
think we
right. So
can continue the session tomorrow
right.
with it's on the same time, and the link will be again shared to you guys 2 hours before the webinar. So see you tomorrow, guys. Thank you so much for joining us.
All right. We'll share you the PPT or the documents, any research papers related to this. So I think that would be posted on your group. And thank you so much, everybody.